My overall impression is that there's a lot of passion amongst the attendees for understanding what we're going to do for our patients and how we're going to bring the best science and new discoveries to make a difference in the way people actually live. And another impression I have is that, at least in the realm of symptom management and patient care and survivorship, that it's not very easy, that we have much more ambition for what we would like to be able to do than we're able to do. And a lot of the trials that we do involve a placebo control, and placebo remains a formidable enemy because placebo wins many of the battles. And whether you're in the poster sessions or the oral sessions, you find one after another example of where placebo beat the intervention, or at least tied. And I think there's a great deal of hope and promise, though, to bringing better correlative science to the realm of symptom management and the understanding of patient care aspects in quality of life. And there were some nice examples of that at this meeting. One example that I was particularly struck by was serum hepcidin, which is a regulator of iron metabolism, being used as a predictive biomarker for who might respond to the addition of iron supplementation when they're getting erythropoietic agents, ESAs. So that sort of predictive biomarker in a symptom management or supportive care realm is relatively novel. There was also a report of a soluble TNF receptor 2 being highly correlated with cognitive complaints. And although that study did not have an intervention component, the idea that we can maybe identify a target for future interventions or for drug development becomes really exciting. Well, I'm hoping to see more disciplines together at the different sessions, and I'm seeing a lot more admixture already. So for example, it's not just the GI oncologists at the GI sessions, the breast people at the breast sessions, the health services researchers going a bunch of parallel meetings where people just meet in the hallways afterwards. But the science is really coming together, where there are basic researchers and animal researchers alongside of and in the similar sessions as patient-oriented researchers. I see things like an example of this in health services research, a lot of information about financial aspects of cancer care and financial toxicities. But that starts to matter to physicians and not just health services researchers as we turn that into a communication issue and figure out how are we going to talk to our patients about these issues and how are we going to frame this and understand the trade-offs. And we haven't really learned to do that, but how are we going to begin those conversations? And we even, along those lines here, even potential study designs that get at these communication aspects. For example, asking a patient, would you take a less effective treatment that might still help for your nausea if you had a $300 inducement, at a discount? You'll take the less effective treatment at a discount. And you can imagine research trying to understand how patients think about those kinds of choices and how it's framed and what it means to them and how they think about their symptoms. So that's health services research, communication research, and basic patient care kind of coming together. I think there's a lot more to be done for patients, and I think we have a lot to look forward to.